biggest misconception about COVID-19 is that some people think that it doesn't even exist.
I don't think people realize how easily transmissible it actually is, and how much more of an issue that is going to be with the new variants. And they are here.
I think the biggest misconception of COVID-19 is that you will not get it. People maybe have become somewhat complacent with the idea because it has been a length of time with us here in our society.
Without a doubt, it's that small actions don't matter. That the sniffle that you think maybe it's a cold and so I'm going to ignore it, the mask that you leave in your car while you're waiting in line somewhere, that friend that you saw inside just that one time, the shinny game you really didn't want to miss. I worry that folks think, oh, well, I'm working from home, or I'm going to school from home, I'm not getting on an airplane, I almost never see my friends, I'm doing my part in every other way. It's just one time. And either don't understand the rules or don't care about how those rules and breaking those rules can have a devastating impact.
The biggest misconception about COVID-19 in our community is that, especially for young people, that it is mild and it's just like the flu and you'll get over it quickly.
And so I think one of the biggest misconceptions is that, what I do will only affect me. And that's not true. And we've seen this now throughout the community. So, a message there would be cognizant of what you do. The downstream effects can be critical.
So those who are struggling with poverty, those who are homeless, people who are impacted by substance use, mental health issues, are finding themselves probably often feeling more isolated and challenged to find the kinds of assistance they need. So I think that is the misconception about COVID, that all of us are experiencing it the same way.
A lot of people in our community think that this is a disease that only affects the elderly. And it is not. It affects everybody. It affects young people and it affects the elderly. This is not like the common flu.
Unless you've been personally touched by someone with COVID, I think it's hard for people to wrap around how big this really is, how easily it can spread, and how we could have shut it down with just following those guidelines, staying indoors.
The biggest misconception of COVID-19 at this point right now is that it only really affects those that are the vulnerable, the ones that are living in long-term care homes, the ones that are old, have previously existing conditions in their lives. But I'm a prime example of that. I had no previous conditions, no health concerns that I know of, and I still got it. And these effects are still kind of with me right now.
We have no idea what the long-term effects of this virus are going to be. You may feel fine, but we don't know 10 or 15 years down the road if there's going to be any potential fallout.